Hello, everybody. I'm Dr. Ho, pulmonary internal medicine and sleep specialist at Shenzhen Chengmei International Medical Clinic. Our topic today is snoring dangerous and what is obstructive sleep apnea? If you have a family member who snores, you may initially just be concerned about how the snoring is disturbing your personal sleep. Or perhaps you may wonder if the snoring is harmful to the snorer's health. The answer lies in whether that person has the disorder known as obstructive sleep apnea. Some snoring is just simple snoring without any adverse effect on one's sleep. However, other snorers have sleep apnea. Basically, sleep apnea is a condition of low oxygen during one's sleep. When all of us fall asleep, our body's muscles relax, including the muscles of the upper airway, such as the tongue, the soft palate, or the throat muscles. Due to a loss of muscle tone in concert with one sleeping and lying down, the muscles essentially fall backward and block the breathing passages, reducing airflow. Eventually, this may cause a drop in oxygen levels. Fortunately, our bodies, despite being asleep, can sense this obstruction and briefly awaken itself from sleep. During this brief awakening, muscle tone returns and the upper airway opens up, allowing for airflow to resume. As a consequence, one's oxygen level returns to normal levels. The problem is that once the patient falls asleep again, the same problem occurs. Hence, there is this cycle where you have this repetitive closing, opening, and so on of the airway. So what type of adverse clinical problems may one experience from this disorder? At the most basic level, one's physiology is affected. For instance, one can experience a brief rise in carbon dioxide levels, a drop in oxygen levels, increased pulse and blood pressure, and increased stress on the heart muscle. As far as one's sleep, as just mentioned, because of the narrowing of the airway, one has to briefly wake up to open up the clogged passageway. Due to the repetitive awakenings, one's sleep quality is affected. Patients may experience fragmented, unrestful sleep or insomnia, and as a result feel tired or sleepy during the daytime. One dangerous consequence of this daytime sleepiness is sleepy driving. I suspect that many of you are well aware of the dangers of sleepy driving and its contribution to serious automobile accidents. In regards to the cardiovascular system, one of the most important effects is hypertension. If you have high blood pressure and snore, it is certainly possible that you may already have obstructive sleep apnea. Given the important connection between sleep apnea and the cardiovascular system, I'll devote another video focused on this topic. Aside from the heart, another adverse outcome of sleep apnea is its effect on our brains. There appears to be a connection between sleep apnea and dementia. In one study looking at over 200,000 patients, investigators found that in those with sleep apnea, the risk of dementia or cognitive decline increased by 26%. Another important association is that with stroke. Another paper looked at 5,422 subjects, and in those with severe sleep apnea, the risk of obtaining a stroke increased by 3 times. Now, returning to the original question and summing up, is snoring dangerous? Basically, the answer depends on whether you have simple snoring or whether you suffer from obstructive sleep apnea, a disorder associated with reduced oxygen levels. If you do have sleep apnea, there's a strong association with hypertension and an increased risk of stroke, sleepy driving, dementia, and insomnia, to name a few. Now that you have this brief introduction to sleep apnea, the next question is, how do I know if I have sleep apnea or my family member has sleep apnea? To answer that question, please tune into my next video, How Do I Know If I Have Sleep Apnea? Thanks for watching today and hope that it was helpful. Thank you. Bye-bye.